in my lifetime, I'll have plenty of post-polio patients surviving that we'll have to treat throughout my career. With future practitioners doing it after I retire, looking towards the future, I hope that we don't need it. I hope that there is better control of polio in other populations and we don't see it. But I also believe that if other countries are still having endemic polio, that we're going to likely see those patients for many years to come, and they're going to seek out centers of excellence to continue to have that treatment because they're unlikely to have it in their country, just because if their countries don't even believe in the vaccine or wanting to have the vaccine, they're not going to develop programs to help treat the people who have suffered from it. So unfortunately, I think that it is here for at least my time in practice, and likely there'll be a need for at least certain centers of excellence to persist to treat any other survivors. And I also believe that a post-polio program can also carry over to a lot of other medical conditions. We have patients with other conditions that I'll put in our polio program, even though they've never had polio, because I believe they can benefit from similar kind of treatment and care. So if you have cardiac patients, cardiomyopathy, you might be able to do that with other neurologic conditions such as progressive diseases such as Parkinson's disease. I think that there's also some of the program that can go and do those other cases as well. So just having it specific for polio, that might change in the future, that it's more for just patients with disability and how to manage them effectively. And I think with what you learn from treating polio patients, it can carry over to other diagnoses as well. So if you don't have the volume to treat just polio, the ability to treat all of these other manifestations of other diseases, I think is also going to be more effectively treated by having that knowledge. It depends. If you're in a non-endemic area like the United States, you might not see new cases in the United States, but people fly and travel and go all over the place. And I can say that within the last couple of months, I've seen a few patients that were in their 20s from other countries, and they've had polio. So I don't think that that's across the board. We have a teenager who we're treating in our Brace clinic now, who we've been treating for years for post-polio as well. So I wish there was not going to be a younger population to treat, but I think we're amiss if we're thinking just on our country and not having new cases and not understanding that people will come to our country and will need these services. So we need some centers of excellence that will continue to provide that service. And if we can build a framework of how to do that and how to treat these patients without needing them to come out here, by educating therapists, by having kind of the things that we do here that they can just kind of roll out, maybe not to the expertise that our clinic can provide, but a lot better than what's provided now, I think that will make a big difference as well.
Seeing a decline in our patient numbers, not as of yet anyhow. So I think, yeah, you're right. I think there's still a few decades of patients we'll have to serve. So it's not finishing at this point. But that's, someone has to advise the population and government agencies about this. It's a problem because most people think that polio is gone. So it takes a lot of awareness raising.
Well, the hospital desperately wants to keep the program going because it's got an international reputation. In fact, I just got off the phone with a lady from Israel who called me. She was referred by a friend who has a brother who's a doctor who agreed to work on the internet and find a resource. And there are other clinics on the East Coast, but the advice was go to Washington. Physicians, but sooner or later, there are other clinics that have closed down. I mean, unfortunately, it is kind of person dependent, and I have a special interest, and a very specific passion. This has been a key part of my own professional life and my own personal history.
What percentage of the younger migrants might you actually see in amongst your 200 to 250 polio patients per year?
It's not large, maybe 10%, 15%.
And where would they generally be coming in from?
Well, from South America. I have a few from Africa and a few from Eastern Europe. And actually there's a couple recently from India. Yeah, 2 or 3 from India.
What do you see the future for these people in accessing information on post-polio as they age?
I don't think it's going to get much better because the researchers have tended to lose interest. I mean, I think either the problem is simpler and it's we've sort of figured it out, or it's quite a bit more complicated, which is my belief that there's probably some underlying mechanism that we haven't figured out. And if polio were to be around for another 50 years, I think, and there were new cases, and there was a lot of interest and excitement in the field in terms of research, maybe we discovered that there is in fact a immunologic component that might be treatable, say. But I don't think that's going to happen because there isn't the money for polio research and there aren't the bodies to do the work. So it becomes a bit of a vicious cycle.
What value is placed on the lives of the remaining survivors of polio in the USA in a world that's largely eradicated the virus in other countries? So how do people feel they're being treated here?
Well, that kind of hits a nerve with me because I hear many times polio people say, oh, nobody cares about us because, we're a dying breed and all that sort of stuff. And I think that sometimes we help perpetuate that by saying that. So there are times that I wish we wouldn't say that we would just stand up and say,
we don't update you.
Yeah, well, right. Or that, that we're people and we, I guess I personally feel, I guess I wouldn't be doing this if I didn't feel it was important, but I personally feel that I don't, as long as, I don't care if I'm the last living polio person on earth, I deserve good health care. And I deserve, a doctor who will listen to me and who will try to spend some time with me to help understand what's wrong with me and treat me the best, the best that they can. I think that's part of what we would like to say to the younger polio people in the world, get 2 or 3 people together and see what you can do and what is the need? Do you need accessible toilets in your area or do you whatever? So I just had an email from a lady from India who found our website and she was thrilled and she said, there are 5 of us that know each other in our city, what can we do? And so that'll be fun to answer that and to talk to her a little bit through email as about what it is that they can do. So I think that's, to me, or to us, that's our future. Stay the course, but also then try to transfer.
1982, started this business. There was Laurel Halstead, Jackie Perry, and what were we told by everybody? Well, there aren't very many polio survivors, and they're all in their 90s, and they're going to die soon anyway. And from 1982 to 2008, you get the same damn story. The facts don't matter. The fact that there are 20 million polio survivors in the world, and we're making more every day, doesn't matter. The fact that those 20 million polio survivors are going to get PPS, especially in third world countries, that doesn't matter. The fact that there are 2 million in the U.S. and Canada, and how many in Australia?
70,000.
70,000+ that we're not sure about in Australia. Doesn't matter. All that matters is nobody remembers what polio was, and they don't really care anyway. And the poor polio survivors now are too poop to even do support groups. There used to be 300 support groups in the U.S. In New Jersey, there are 8 million people, 50,000 with polio, At the height, there were 11 support groups. Now there's 2. Polio has returned to America. Polio has returned to Australia. You know, now is the time to do something about it. And the president of Rotary, you know, there's what's called a fellowship, which is sort of an organization of Rotarians that is allowed to use Rotary's name for PPS. And I think it started something like 5 years ago, give or take. And it really didn't go very far. You know why? Because all the Rotarians in the fellowship had polio and have PPS. It still boggles my mind that this is the only condition where the people who have to run the support groups for the condition have the condition. But then again, God and I have a lot to talk to when she and I meet, and that's one of the issues. But if maybe that's something that we can do. There's a new president of Rotary coming in who's from Korea, I think. And when he comes in June or before Wolf Wilkerson leaves, maybe we can put together a plan to focus on 08, 09 and get the clubs to distribute the information. Well, in terms of the NIPID campaign, which hopefully will focus both on vaccination and on post-polio sequelae, Rotary has agreed to distribute information to their clubs. Now in North America, and then probably later in the year and next year in Canada, in South America, and why not in Australia? It doesn't take a heck of a lot to send a flyer of some kind and say, give it to the club and say, we would like you to take this to your pharmacy, your doctor, your local hospital. There are something like 350,000 Rotarians in, I think, North America. Well, that's a lot of folks with a lot of posters. If we could get 350,000, posters out, that'd do a lot of good.
20 years ago, presented with my first post-polio patient, I was completely clueless. It was not something that was taught in medical school. They didn't even teach about acute polio because it was felt to be a disease of the past rapidly on its way out. And it really took the actions of our local support groups to educate me. And I feel very fortunate that my program was targeted to develop a post-polio clinic. Otherwise, I would still probably be in the dark. In the community, level of knowledge amongst neurologists, amongst general internists, orthopedists, very, very low. I think the group that knew most about post-polio was the physiatry group, the rehabilitation medicine specialists. And they still are the main resource in the community if somebody's lucky enough to find one. And isn't being seen by a neurologist who is knowledgeable or an orthopedist who is knowledgeable. The first 10, 15 years that I spent working in post-polio was really developing the clinical networking that I needed to treat the patients and to educate the patients, involving physical therapy, working on ways to get the message across to the patients and to reinforce what they needed to do. It was really only at the Warm Springs meeting in 2000 where March of Dimes sponsored a meeting of many of the people that you're going to be speaking with, and I was fortunate to be there, talking about symptomatic medication, that it was recognized that there was a need to educate the greater community of healthcare professionals, not just physicians, nurses, physical therapists, occupational therapists, people who dealt with polio survivors with their multiple, medical needs, to recognize what was going on and to make proper recommendations. So, an educational plan was developed, sponsored by the March of Dimes. A couple of very nice brochures were put out, one aimed at healthcare professionals and one aimed at the lay community, explaining what post-polio was and the proper approach to it and how to evaluate it and treat it in the physician's brochure. In California, the medical board picked up on this information and published it in their semi-annual newsletter. So every physician in California got to see that because they all get the newsletter. What I've been doing over the last 8 years or so is kind of increasing my teaching in the neurology clinic. My Thursday afternoon new post-polio patient clinic has residents in it. They all see the polio patients, and then we discuss them and we go over treatment planning and diagnosis of other things. Not everybody who's a polio survivor has post-polio. Some have other neurologic problems that need to be recognized. I have worked with the rehabilitation medicine residency program at our Veterans Hospital and hosted their residents in my clinic. I give an annual lecture at the VA about post-polio. I give grand rounds at one of our county facilities on post-polio, and about every 2 to 3 years I give a talk here at UCLA on post-polio. I speak once a year, once every other year at a community hospital, scattered around. I seem to be on the lecture circuit there. So I think it's important to get the word out, at lunch conferences, which are attended because they offer free food, to get the word out at more didactic sessions. I think in the neurology community, at the annual neurology meetings, and there's 2 major meetings that go on, there's very little being presented about post-polio. If you see a presentation, every other year, if you see a couple of abstracts or poster sessions that are presented that deal with post-polio, it's a lot. So I think at that level, we still haven't broken through, but certainly in education of residents and people coming up through the medical system, we've done a tremendous job just in the last few years.